Hello, everyone. Thank you for joining me today for this webinar. My name is Dr. Sarv Varta Khalsa, and I'm a naturopathic physician, and I have my practice here at Living Wellness Medical Center. And I've been in practice for a little over 20 years, which is amazing. Time flies. And I've been here at Living Wellness Medical Center for about 6.5 years. And we have a wonderful group of doctors here. And we kind of rotate. We provide webinars every month, and we rotate who gets to present the webinar for that month. And this month I'm up. So being October, I thought it would be appropriate to talk about breast cancer and being Breast Cancer Awareness Month. So today I'm going to be talking about breast cancer screening as well as strategies for supporting breast health, because we all know that prevention is the best medicine. So let's jump right in. And just real quick, if you have questions, definitely feel free to put your questions in the chat. I would ask you to wait till the end. I will answer all the questions at the end of the webinar. But I would be happy to answer any questions that you have. Okay, so let's jump right in. So let's first talk about breast cancer statistics. So first off, as I mentioned, October is Breast Cancer Awareness Month, and October 13th, which is today, is Metastatic Breast Cancer Awareness Day. So breast cancer is the most common cancer in women in the United States, except for skin cancer. And the American Cancer Society's estimates for breast cancer occurrence in the United States for the year 2023 are that about almost 300,000 new cases of invasive breast cancer will be diagnosed in women this year in the United States. Almost 56,000 new cases of ductal carcinoma in situ, or DCIS, will be diagnosed. DCIS is a less aggressive form of breast cancer where there are abnormal or cancerous cells in the lining of the milk ducts. And it very often stays contained and doesn't spread and turn invasive and spread into the rest of the breast tissue if it is diagnosed and treated early enough. So it's considered, kind of less aggressive than other types of breast cancer. And then about nearly 44,000 women will die from breast cancer in the United States this year in 2023. So overall, the average risk of a woman in the United States developing breast cancer sometime in her lifetime is about 13%. So not super high, but also not super low. So this means that there is approximately 1 in 8 chance that a woman will develop breast cancer here in the United States. So we should talk about what we can do for screening. So here are all the different options for breast cancer screening. I'm going to go into each of these in detail. So the first is a mammogram. That's sort of the standard of care that most women choose and do. We'll talk about frequency in just a little bit. An ultrasound, MRI, thermography or a thermogram, physician exam, so going in for your annual well woman exam where the doctor does a breast exam. And then, of course, super important, equally important, if not more, is doing self-exams at home. So I'll talk about that as well. So let's start with mammograms. So a mammogram is an X-ray picture of the breast. And so there is some radiation exposure with mammograms. And so I get a lot of questions about this from my patients. They're obviously coming to see a naturopath because they are wanting to support their health in a natural way and want to keep their body as healthy as possible and reduce any potential risks to their health. So I get a lot of questions about radiation exposure with mammograms and do I recommend them or not? it's a little bit of a tricky question, but I just wanted to talk about it a little bit. So a typical screening mammogram uses about 0.4 to 1.0 millisieverts of radiation. Just as a comparison, a 3-hour plane ride delivers about 0.1 millisieverts of radiation. So it's maybe 4 plane rides, 3-hour plane rides for the year is equivalent to the minimum of a mammogram. We're also exposed to about 3 millisieverts of background radiation in our natural everyday surroundings on an annual basis. So that gives you a general idea of just, we don't get just exposed to radiation with things like mammograms and x-rays. It's sort of in our environment as well. And so getting a mammogram is about the equivalent of about 7 weeks of normal everyday life. So that doesn't necessarily mean that we need to, minimize this. There still is that extra radiation if you get a mammogram, but it is pretty minimal. And so, I kind of leave it up to my patient's comfort level in terms of making that decision for themselves. I am a proponent of screening with mammograms, not necessarily every year. And we'll talk about that, but, it really just depends on the individual, density of breast tissue, family history, personal history of breast cancer, and things like that. So it really depends on the person. And my recommendations are individualized based on that. So there are different types of mammograms, 2D mammograms and 3D mammograms. 2D mammograms used to be the norm, and now it's more 3D or 2D and 3D combined. And so, which is better. 2D mammograms, so they each have benefits and risks. And so I'll go over that. So the benefits of a 2D mammogram is that there is less radiation. So it's going to be more on the lower end of the 0.4 as opposed to the 1.0 in that range of the millisieverts of radiation that you're exposed to. The downside is that the 2D mammograms are not as accurate in women with dense breast tissue. And so it may not pick up abnormalities as well. 3D mammograms, the benefits are that they're more accurate, especially with dense breast tissue. So they're better. They better detect breast cancer by up to about 80% is what the research shows compared to a regular 2D mammogram. And so that's kind of why they've become more the standard of care and the norm. I know that I typically will order a 3D mammogram for my patients that need a script for that, an order for that. Another benefit is that there are fewer false positives. You don't want to have a lot of false positives because that leads to additional imaging, not to mention the stress and anxiety that comes with, hearing, oh, your mammogram's abnormal, and then just having to do more testing, maybe even do a biopsy. It can be pretty nerve-wracking. And, for a lot of women, it happens, it's a false positive. It's unnecessary. It ultimately turns out to be nothing. And that is one of the reasons why some organizations changed their sort of their recommendation, and I'll talk about this more, from annually to every 2 years, just to decrease the number of false positives that can happen. So the downside with 3D mammograms is that there is more radiation, and because typically they'll combine 2D and 3D images to sort of create a better view of the breast tissue. So a 3D mammogram, 3D mammography is also called tomosynthesis, and sort of a new type of digital X-ray mammogram that creates 2D and 3D-like pictures of the breast. So you just get a better view of what's going on. This was developed in 2011, so obviously it has been around for a while. It's not that new, and it is now considered the standard of care. And it improves the ability of the mammogram to detect early breast cancers. And also decreases the number of false positive findings that may lead to further imaging and or biopsy because they just can see it more clearly. And so they don't necessarily need a better look with something else. So in the month of October, being Breast Cancer Awareness Month, Simon Med, and they do this every year. Simon Med Imaging is offering cash pay specials, $50 for a 3D screening mammogram, which is a really great deal, and $75 for 3D whole breast ultrasound screening. And so those are options. If you are interested in that and maybe you don't have insurance, you can look into that. Typically, though, if you do have insurance, definitely screening mammograms are covered. Every insurance company is sort of, I think, required to cover those. So let's talk about guidelines for screening. And so generally every 1 to 2 years is recommended if there are no risk factors. And so, once again, it does depend on the organization, what their recommendations are going to be. In May of 2023, the United States Preventive Services Task Force issued new recommendations for breast cancer screening that lowered the age at which women should start screening from 50 years old to 40 years old. Many other organizations have had that guideline, for a while. So they recommend that you start breast cancer screening at the age of 40 instead of 50, and that you get screening mammograms every other year from ages 40 to 74. The American Cancer Society recommends a woman between 40 and 44 have the option to start screening with a mammogram every year. And then women 45 to 54 should get mammograms every year. And women 55 and older can switch to a mammogram every other year, or they can choose to continue yearly mammograms. It's generally recommended that screening should continue as long as a woman is in good health and is expected to live at least 10 more years. So, and, my general recommendation was somebody that does not have a lot of risk factors and hasn't really had an abnormal mammogram before in the past is every 2 years. But, once again, it really depends on the person and the case, density of the breast tissue and things like that. So next is ultrasounds. So a breast ultrasound uses sound waves to create computer pictures of the inside of the breast. So there is no radiation exposure with ultrasounds. And it can show certain breast changes, especially like fluid-filled cysts, that can be harder to see on mammograms. And so they're most commonly used as a secondary imaging to further evaluate abnormalities that are seen on a mammogram. If they just sort of want to take a closer look at a particular area, they will order an ultrasound after the mammogram. And I have some patients where every year or every other year, whatever frequency they're doing their mammograms, I will order a mammogram with a reflex to ultrasound. And that way, they can just do it right away. If they don't need to call the office and, all this wait time and everything, they can just go ahead and do a diagnostic ultrasound right away. And so for some of my patients, I order it that way. So ultrasounds can also be used to evaluate breast tissue in general, but it's not the standard of care for breast cancer screening. Now, some women choose to use it that way. It's certainly way better than not doing anything, but it's not considered the standard of care compared to a mammogram. And so, but like I said, some women just don't want any radiation exposure. And so an ultrasound is a reasonable second option. And especially if there is a suspicious lump or something that we feel on physical exam and we want to have it checked out, definitely want to do an ultrasound. Most imaging centers actually won't perform a breast ultrasound unless a mammogram has already been done, which I think is kind of annoying. I don't like that. And it's interesting because I did have a patient recently that did have, I think it was at Simon Med, they actually did do a breast ultrasound without a mammogram. So I don't know, maybe they've changed their guidelines on that, but generally they will not do that. So So women who prefer to not get a mammogram but just want an ultrasound, I refer them generally to a company called HerScan. And you can find them online. HerScan is a mobile breast ultrasound screening company. They're cash pay only, so no insurance. You don't even need a prescription for it. In ultrasound, and on their website, they talk about the fact that an ultrasound can increase the detection of breast cancer from approximately 48% to 97%, particularly in women with dense breast tissue. So, as I said, it can be a nice sort of backup to a mammogram in terms of getting a better view of the breast tissue. Ultrasound screenings are capable of detecting cancers that cannot be found by mammography and physical exams alone. So that's another benefit. And of course, benefit, as I mentioned, there's no radiation. There's also no breast compression. So there's no pain involved. A lot of women don't want to get a mammogram because guess what? It's not fun. We all know that. And so, they have to compress the breast tissue and it can be pretty uncomfortable. I think they've gotten better with time and better technology, but there is still some compression involved with mammograms, but not with an ultrasound. The cost generally of a breast ultrasound through HerScan is $285. And the results are emailed within 7 to 10 business days. So next, let's talk about MRIs. Breast MRIs are not usually used for screening because they're typically not covered by insurance because they're expensive and insurance companies don't want to pay for them. So the other kind of downside potentially is that they can actually be too sensitive and pick up things, that are seen as a concern but really are not a concern. And this can lead to unnecessary biopsies and things like that. So, however, the way that they can be used is if breast cancer has already been diagnosed, then a breast MRI is sometimes done to help determine the exact size and location of the cancer, and also to look for other tumors in the breast, to check for tumors in the other breast. So just get a more detailed look at the breast tissue. And it's also generally recommended to alternate a mammogram and an MRI every 6 months in women with increased risk for breast cancer. I have a number of patients that do this. And one of the benefits of, and a lot of times if you have certain risk factors, whether it's personal or family history, insurance will sometimes cover an MRI. And so the reason to alternate the mammogram and the MRI is that MRIs do not have any radiation involved. And so, getting a mammogram twice a year is doubling your exposure to radiation. And that can potentially be a concern if you're doing too many mammograms, especially within, 1 year. All right. Thermograms. Some of my patients opt to do a thermogram rather than a mammogram. A thermogram produces an infrared image that shows the patterns of heat on or near the surface of the breast. And this can indicate increased circulation, stagnant lymphatic flow, or inflammation. And so, it kind of generally gives you information about the health of your breast tissue and if there are any areas of potential concern that would show up as increased areas, with the heat pattern. However, it's very nonspecific, as you can see. And so it's not, so if a thermogram comes back with an area that's sort of abnormal or of concern, they will refer for a mammogram. And so it's a different way to look at the breast tissue, and but it's not very reliable also for screening for masses. An ultrasound would be much better option if you have a mass that you're wanting to evaluate. It's a great option for people that don't want to get a mammogram, and it's like I said, it's not considered standard of care, and it's also not covered by insurance. So and as I mentioned, if you have an abnormal thermogram, then they will, and I will, if I have a patient that has an abnormal one come back, recommend a mammogram typically, or I suppose an ultrasound if that's really their preference, strong preference. So let's talk about breast exams. We're talking about all the fancy screening and imaging, but it's also really important to feel your breast tissue on a regular basis. And so physician exams are generally recommended once a year as part of your well woman exam, along with your PAP and your pelvic exam. And any possible abnormalities that are felt during the exam can then be further evaluated with a mammogram or an ultrasound. Self-breast exams are extremely important. And generally, I recommend doing them monthly. And the benefit, of course, of doing this is that you get used to what is normal for you with your breast tissue, because our breast tissue can be a little lumpy and bumpy and things like that. And it doesn't necessarily mean there's something seriously wrong. It's just, you have dense breast tissue, or you have, nodules and fibrocystic breasts and things like that, which is pretty common. So you kind of want to get used to what your normal lumps and bumps feel like. In that way, if you notice anything new or something that's really changed, then you can have that checked out, go see your doctor about that. So self-breast exams, the general guidelines, you want to lay on your back. Some people like to do it in the shower, and that's fine. But otherwise, lay on your back, on your bed, or somewhere with your arm over your head like this. And that helps to kind of flatten out the breast tissue so you can feel it a little bit easier. You also want to choose a distinct pattern that you use each time. You can do a spiral for, starting on the outside and going in toward the nipple. You could do a back and forth, palpating back and forth like that. And the benefit of using a particular pattern is you're not just randomly poking around your breast tissue. And so you're not going to miss anything is the bottom line. You want to just make sure you cover all of the breast tissue when you're doing the palpation of your own breast tissue. And of course, I do that as well. When I'm examining a woman's breast during a well woman exam, I use a spiral pattern from out to in. And then you want to, timing wise, you want to generally do your self exam maybe 3 to 5 days after your period ends, if you're still having your periods. Otherwise, just any time is fine. Maybe it's the first of the month. That helps you remember to do it. But 3 to 5 days after your period ends is when things are kind of the most stable with your breast tissue, and they're not like changing, shifting, things like that. And they also might be a little bit less dense during that time. So another option is genetic testing for breast cancer. And so there is a company called Natera that offers hereditary cancer testing. And we do offer this at our office. If you are interested in that or have questions about it, feel free to ask your doctor about it if you're a patient here at Living Wellness Medical Center. Individuals with hereditary cancers have a higher than average chance of developing certain cancers in their lifetimes. So these individuals are also at risk of developing cancer at a younger age. So who should get tested? You should get tested potentially if you have a personal or family history of cancer at the age of 50 or younger, especially breast cancer. If you're of Ashkenazi ancestry, they have a higher risk, just genetically. If you have a personal or family history of ovarian, male breast, or pancreatic cancer, there's an association there with increased risk. Or if you have multiple cancers on the same side of the family. Natera offers comprehensive testing for 81 hereditary cancer genes, so it's pretty comprehensive. And it is evaluated with a simple blood test. And then your physician, your doctor, can go over the results with you. So that's the information I have about screening for breast cancer. What I'm going to talk about next is prevention or tips to support breast health, because we want to do that too, right? Prevention is the best medicine, as I mentioned. So generally, you want to eat a healthy, balanced diet. You want to maintain a healthy weight. You want to get regular exercise, prioritize sleep. Sleep is so important. Limit alcohol, avoid smoking, get yearly physicals and blood work with your doctor, and just make sure you're keeping up with your self-care. So let's talk about diet. I want to delve into diet because there's so much that you can do with diet to help support healthy breast tissue. and healthy breasts. So, let's jump right into different dietary things that you can do to support healthy breasts. So eliminate sugar, white flour, and refined processed foods. These foods basically, they increase insulin-like growth factor, IGF-1, which has been linked to an increase in breast cancer growth. So generally, those things should be avoided or at least minimized. You want to eliminate methylxanthines. So these are things like coffee, tea, chocolate, all the fun stuff, of course, colas and other foods or beverages that contain caffeine. And at least minimize, if you're not going to eliminate, at least minimize, depending on your risk factors and things like that. Caffeine and coffee increase estrogen as well. So if you have, especially an estrogen receptor positive breast cancer, it's especially important to avoid caffeine if you have that history. You want to eliminate or minimize red meat and fowl unless it's organic or grass-fed and has not been treated with hormones. And that's the main issue with eating too much meat and animal products in general, is that these animals are often treated with hormones that make them grow bigger, faster, produce more milk and things like that. And then those hormones get concentrated in their tissues and in the milk, and then you drink that milk and you eat that meat, and then you're exposed to those extra hormones that your body really doesn't need. Decrease fats, especially animal fats. So research has shown that a low-fat diet was found to reduce breast cancer occurrence. And then decrease dairy products such as milk and cheese. As I mentioned, dairy cows are often treated with growth hormone to increase milk production, but that can increase IGF-1, which, as I mentioned above, can increase, it's been linked to an increase in breast cancer growth. And then you want to increase complex carbohydrates, vegetables, fruits, whole grains, all the good healthy things that we know we should be eating and hopefully are eating. You want to increase your consumption of garlic and onions. They contain sulforaphanes, which have been shown in studies to reduce breast cancer expression and growth. You want to increase cruciferous vegetables. This would include things like broccoli, Brussels sprouts, kale, cauliflower, collard greens, bok choy, mustard greens, and radish, among other things. And these contain something called DIM, which helps to eliminate the so-called bad estrogens that can get sort of converted into the less desirable metabolites of estrogen that are not protective and can be the opposite, with breast cancer. And so it just helps to ensure healthy estrogen metabolism is occurring in your body. You can also, of course, take supplements. I recommend DIM a lot as a supplement to my patients for different reasons, any kind of estrogen issue and that sort of thing. If they have estrogen excess, especially. Eat fruits and vegetables that are rich in beta carotene. Any fruit or vegetable that's red or orange or yellow contains beta carotene, and that may reduce the risk of breast cancer as well. You want to eat fruits and vegetables that are rich in lycopene, which is an antioxidant. So things like strawberries and tomatoes and fruits or vegetables that are red in color contain lycopene. Also really great for the men, also really great for prevention of prostate cancer and supporting prostate health. Lycopene might be protective against breast cancer as well. You want to eat healthy fats. So nuts and seeds and avocados and olive oil and wild-caught salmon are all really great sources of good fats. So it's not, when you talk about fats, you don't want to always avoid all fats. You just want to avoid, the bad fats, and you want to eat the good fats, the good healthy fats. You want to consume spices that are anti-inflammatory, things like turmeric and ginger and garlic, and this can be protective as well. You can eat ground flax seeds, and they do need to be ground to kind of release the things that are helpful in this case, for eliminating estrogen. And so the suggested dose is anywhere from 1 to 3 tablespoons per day. And studies have shown that, suggested that flax seeds help to reduce estrogen stimulation of breast cancer cells. And they also help to eliminate estrogen. They're a great source of fiber, so they help to kind of bind hormones and cholesterol and carry them out of the body. Plus, they have a weak estrogenic effect in the body, which is a beneficial thing because rather than being a strong estrogenic effect with your estrogen actually binding to the receptors, it binds and has a weak estrogenic effect, which is a benefit. You want to eat organic berries. They contain phytochemicals that have been shown to help reduce cancer growth. Medicinal mushrooms are amazing and fabulous. I just love them. I recommend them a lot to my patients. I take them myself. Maitake, shiitake, reishi, you could take a combination supplement. We have one that we carry here in our office that I love and recommend a lot called 10 Mushroom Formula, where you can include them in your diet as well. And these may be protective against cancer as well, among other tremendous health benefits. They're great for so many things. Drink green tea. So this also may reduce the risk of breast cancer recurrence and causes cancer cell death. If you do have cancer, drinking green tea is a good thing. And it's helpful in reducing total circulating estrogens as well. You want to limit alcohol consumption. No more than 3 servings per week is generally recommended, especially for women. And drinking more than, little typo there, more than 1 serving per sitting may increase your breast cancer risk. And so you really want to limit alcohol consumption. And just for overall general health, that is a good idea. So in conclusion, breast cancer is a common cancer among women. Screening for breast cancer is, of course, vitally important in order to detect it early so it can be treated successfully. There are many different options for screening, as I discussed. And we all know an ounce of prevention is worth a pound of cure. I love that saying because it's very true. So a healthy diet and lifestyle choices can help to decrease your risk of developing breast cancer. And that is a good thing. So at this point, I would like to open it up for any questions. And you can simply put your questions in the chat if you have any, and I'd be happy to answer them. No questions so far. I'll wait a minute or so. Okay, no questions so far. If any come up, I'll certainly answer them. So first off, thank you so much for attending this webinar today. I appreciate you taking the time out on a Friday to do this, and hopefully you learned something from the webinar today. Oh, there's a question. How often would the blood test need to be performed? Annually? Yes. If you're talking about general kind of lab testing, I recommend annually, once a year, to do kind of basic testing. And then more frequently than that, if we're wanting to monitor progress with a particular area that we're treating and supporting, then I might recommend rechecking something, in 6 weeks or 3 months, something like that. Hopefully that answered your question, Lisa. Let's see, the cancer screening blood work. No, that's just a one-time thing. That's actually a genetic test. And so that, your genetics, more or less, they're there and they're stable. And so they're not going to change. So it's not like a test that you get done more than once. It's just a single time that your blood is drawn. It tests for those different sort of mutations with the genetics, with the different, things that they're testing. And then, based on those results, you kind of have a general idea of what your risk is, as well as, other things as well. And so, yeah. Okay. I'll see if any other questions come through here. So it was recommended at my mammogram this week by the technician that performed my mammogram. Oh, okay. Yeah, I mean, this test is gaining, I think, gaining a little more awareness, popularity, momentum in terms of people kind of knowing about it and potentially utilizing it. It's a fairly recent addition to what we offer here at Living Wellness Medical Center. I actually have yet to order one. I haven't had a patient requested or, had the need to, order one for a patient yet, but it's definitely something that we offer. And so you should ask about it. So, but yeah, that's interesting that your mammogram tech mentioned it. All right. So, I'll kind of see if any other questions come through here. But yeah, as I mentioned, we do monthly webinars here at Living Wellness Medical Center. And so feel free to tune in next month. We'll have another great webinar for you. Thank you, Lisa. I'm glad you enjoyed the presentation. I'm glad it was helpful. So, and then this particular webinar will be eventually, after I think 2 or 3 weeks, available on our website. We have a link to all of our webinars on our website, so you can visit our website and look for that. Or if you want to, recommend the information, the webinar to a friend or family member, you can have them go to our website. I'm also going to be sort of translating this presentation into an article that will also be on our website, kind of as part of our blog, and it'll be sent out as part of our newsletter as well. So it looks like there aren't any other questions. So I'm just going to wrap up for today. And once again, thank you all so much for joining me today. And I hope you have a great weekend. All right. Thanks. Bye-bye.